Hello, everyone, and welcome to another episode of Common Sense with Dr. Ben Carson. I'm your host, Ben Carson, and today we're addressing an issue that cuts to the very heart of our responsibility to the next generation: the rising exposure of children to THC and other intoxicating substances derived from cannabis. Across the country, hospitals are seeing an alarming spike in young children, some as young as toddlers, being rushed to emergency rooms after ingesting products that look like candy but are laced with high potency THC. We're also seeing teenagers suffering long-term mental health effects from regular use, all while the marketing of these things is growing increasingly deceptive and targeted toward youth. Joining me today is Diane Carlson from One Chance to Grow Up, a Colorado-based nonpartisan nonprofit focused on protecting children from THC through transparency, education, empowerment, and policy. Welcome, Diane, and thank you so much for being with us to discuss this very important topic.
Hi, thank you. Thank you so much for having me and covering this topic.
Well, the first thing I want to do is just talk about some basics here. What exactly is marijuana? What are the main chemical compounds found in the plant? And can you tell us the difference between THC and CBD?
Absolutely. And that's part of the problem. Marijuana is a very complex plant. It's got a lot of cannabinoids in it. And CBD is really known as the non-intoxicating cannabinoid in marijuana. And to be honest with you, that's where a lot of confusion has come, because a lot of the, media highlighted the really high CBD and the low THC products. I know CNN did a 3-part series on this. And so there's a big perception that the marijuana being sold today is that high CBD and low THC. But THC is the cannabinoid in marijuana that really has been linked to the harms. It creates the high, it creates the psychoactive properties. And unfortunately, with commercial sales, the rollout of commercial sales, it's really THC that has been amped up and skyrocketed, really to levels that could have never been produced in the actual plant. I mean, we work a lot with folks in the industry, and they'll tell us, no matter what you do to breed that plant, to do whatever to that plant, it's very hard to get it above 12%. And that all these products are really being spiked. They're being made in the lab. And there are now products up to 99% THC.
And I've heard it said that what we're seeing these days is much more potent than what we saw, 40 years ago when the hippies were around.
Yeah, much more potent. And really in the 1960s to the 1980s, it was really 2% and under. And it really didn't even get to 5% until about 2000. And then once the sales, there's been a huge spike where, the last time, it was measured, it was like at 8.5%, and then it just shot right up. And we've got THC levels up to like 95%.
Well, is there we hear about medical marijuana and recreational marijuana. Is there a legal distinction between these categories?
Well, yes, and it really depends on the state. I mean, the issue is, are the products different? And, you've got a patchwork of regulations and laws throughout the country where it has been legalized. I'll just tell you the story of Colorado. There was no regulation on medical marijuana, and they started opening up shops. And then when we legalized recreation, instead of like cleaning up the medical marijuana and putting some really good safeguards in place, they just kind of built the industry side by side. And it's been a huge issue. It's been a huge issue because, like, the 18 to 20-year-olds that could get the medical marijuana, like seniors in high schools, they wanted to be enterprising and they were bringing it into the schools. And so it took, like, all our schools stepping up and saying enough is enough to try to close some of these loopholes, which have been very hard to close.
Well, there's been a lot of problems. Like there was a disturbing incident at Hayes Elementary School in Oklahoma City, where children mistakenly consumed THC edibles that were brought to school, made to look like candy. And one of the emergency room physicians there, Dr. Ryan Brown at Oklahoma University, says he daily treats children who are involved with eating these edibles and getting into trouble. And the state has seen a shocking 381% increase in poison control calls for children 6 to 19, and an almost unfathomable 2,519%, 29% increase in children under 5. I mean, this is incredible stuff, and the rapidity at which it's going. And stories of small children being poisoned from accidental THC candy ingestion are showing up in newspapers all over the country, not just in Colorado now. And just in the past few weeks, in Michigan and upstate New York, where studies showed a staggering 1,375% increase in incidence of children under 5 consuming THC edibles over a 4-year period. I mean, beverages are being infused with THC now.
Yeah.
Just incredible things. I mean, why are so many THC products packaged to look like candy and snacks? And is this legal, what they're doing?
Sad to say, I mean, this is the problem. It has been incredible, the amount of incidences. And also, these are really severe symptoms. These kids suffer a lot. I mean, and there have been deaths. And to be really honest with you, it's so deceiving, and it's also very deceiving not only for the child, but a lot of these parents don't realize
Right.
how psychoactive these products are and what they can do to the kids. But the sad thing is, what we've seen, and just by the way, we've turned national because we've had so many states reaching out to us now saying, we need help. We need help. What can we do about this? Because it's such a big problem. And sad to say, there have been very few, if any, safeguards on the actual products themselves. I mean, you may say that there's licensing, there may be things that states have done, but when it comes to the actual products and what has been allowed, and even to, like, there have not been any caps on, very few caps on serving size, package amount. I mean, it's really kind of the wild,
Right.
west on this.
Well, vaping is starting now too, isn't it? Vaping with THC.
Yes. And in 2018 to 2019, there was the biggest increase in teen vaping of any substance in the country.
Is there a difference in terms of the effect that it has on the body, vaping versus smoking marijuana?
Well, I mean, I think the science is not out on that, but the problem is that the concentration of the liquids in the vapes are like nothing anyone's seen before. There
Mm,
is no cap. I mean, just to put this in perspective, when we had the jewel crisis with the nicotine,
right,
the concentration of the nicotine in the jewel was like 5 to 7%. The liquid in the THC vapes, which can look very much like the kid-friendly nicotine vapes,
right.
can be up to 99%. So they're having a huge impact, and we're seeing it. Schools are saying, kids can be using it discreetly. And I mean,
Because
it
they can make it look like a pen or anything that the kid might be using in his school supplies, right?
exactly. And there's like even inhalers that pack really high, potency THC that you can't tell if a kid is using that. But even worse is that these kids have not gotten the information of the impact they do have. And they have not been informed of the harms because there's been a real message that, all marijuana is benign and
Right.
it's pretty harmless. And the perception of harm has definitely gone down for
Well,
adults and kids.
it sounds like we need to be working on some of the state legislators to inform them of what's going on, because they allow these loopholes and all these mechanisms whereby these companies can do this. And these companies have no concern whatsoever about the young people that they're affecting.
No, as a matter of fact, the research shows that people that are using today and have troubles used marijuana when they were under the age of 18. So it just shows these kid friendly products. I mean, who are they targeting? you
Yeah.
know, it's very apparent that they're targeting our kids.
When the brain starts developing right after conception, millions of neurons every day, later on, billions of neurons every day. And when a baby is born after 9 months, the brain is still developing very rapidly, which is why newborn babies sleep so much, 20 hours a day. But the brain continues to develop right up until the mid to late 20s. So exposing that developing brain to some of these products can probably have some pretty deleterious effects. What are some of the things that happen to the developing brain when we expose them to THC?
Yeah. Well, the very young developing brain, which is really concerning because a lot of pregnant women are being told that these products are great for nausea and all kinds of things, when they can be very detrimental to the baby. They can have, I mean, this better than anyone as a doctor, but low birth rate, it can affect them actually neurodevelopmentally for the rest of their lives. I mean, really serious consequences. And these women are devastated when they find out what these risks were, because they were recommended. I mean, there's been a study that showed that 70% of dispensaries that were surveyed were recommending it to pregnant women. And then, of course, just as you said, I mean, the brain continues to develop until, age 25, and they are showing the links of high THC. And this is at levels way lower than what's being sold, has been linked to psychosis, all kinds of psychiatric disorders, including schizophrenia, which is really serious and costly and devastating for families. That, it worsens mental health symptoms. And as you know, our kids are already suffering and trying to cope with a lot of things out there. And then there's actually a syndrome today where people can die from it, called cannabis hyperemesis syndrome. It is unrelenting vomiting. And there's so many people that aren't aware of it. There's a Facebook page with 20,000 people. And when we shared these warnings, they were furious. They said, no one ever told us this could happen.
Right.
I mean, it was devastating, and as well as addiction. And then it's been linked to suicide, ideation, and attempts.
Right. Well, the brain actually has cannabinoid receptors. And when the stuff gets in the bloodstream and it connects to these receptors, and it can affect emotions, fear reactions, time perception, memory, significant functions in terms of academic performance. If you want your kid to be smart and do well in school, maybe you should be listening very carefully to what's being said here. That developing brain, this is not doing that developing brain any good whatsoever. But should parents be concerned, though, even with low-level THC use in adolescents?
Yeah, they really should. And what's really deceptive is a lot of parents, we do a lot of presentations, and we show the products. We've actually taken parents into dispensaries and media because they were like shocked, because their perception is this is like, the marijuana from yesteryears. It's not that harmful. There's been a lot of messaging that it's safer than, alcohol and other substances. And
Right.
the campaign about showing that it's harmless has been very powerful. I mean, even 70% of pregnant women that were surveyed thought it was not harmful.
Mm-hmm.
So we have a real problem. There's a real disconnect of the actual harms and the products that are out there. And one thing that is very dear to my heart, my youngest son had intractable epilepsy. And I sat there and watched how, the people with having kids with seizures were really being used
Mm-hmm.
to advance these other products. And CNN did a survey, and it showed that 40% of parents thought that the marijuana being sold in the dispensaries was CBD, the
Mm-hmm.
non-psychoactive part
Right.
of marijuana. So there's a lot of confusion out there. And a lot of parents are really confused when their kids have serious, serious issues, and they just say, I had no idea. I had no idea this could do this to my child.
Absolutely. Well, what are some of the alarming cases and trends that you've seen through your organization's work?
Well, there's definitely been a rise in emergency department visits, and as you heard, poison control. But the other thing that is really concerning is that uh, THC is the number one substance. I mean, we haven't looked at every state. Not every state really tracks this, but we did track it in Colorado. We worked hard actually to make sure we did. And there's been a huge rise in suicide, but also THC is the number one substance by a large margin in teen suicide. And the connection between suicide is something very, very disturbing. And we've seen a lot of families that have been harmed, and they're coming out and they're speaking about it. There's many groups that are now forming. I mean, there's momentum around this, but again, there's so many people that are unaware.
It really is concerning. One of the big problems that we are having is family formation.
Mm.
Traditional nuclear families are not forming, or they're breaking apart early. Children don't have that safe haven to go to, and therefore they're looking for other escape mechanisms. And this appears to be one of them. And there's significant consequences to this kind of activity. And I hope some of the parents will stop and think, before you destroy your family, before you break up, think about the kids. Think about why you married that person in the first place. Think about the good qualities. Don't just dwell on things that irritate you. Uh, because,
True.
there was a time we said to have and to hold till death do us part. Now it's to have and to hold until you get irritated with each other. That doesn't really work, and it certainly doesn't work for the children. There have been studies that have shown that children who come from traditional nuclear families do better in all aspects of life, and certainly have a lot less anxiety, depression, and suicidal ideation. So we don't need these substitutes. We need, to go back to the basics. But I
So
want to
true.
ask you a little bit about intoxicating hemp. Um, what is it, and why should people be concerned?
Yeah, this is a huge problem. There, because of lack of clarity in the 2018 Farm Bill, there has been an explosion of intoxicating, psychoactive, hallucinogen, I don't know, whatever you want to call it, of these products that are they're not age gated. They don't have product safeguards. They're not being regulated in any way. And they are being sold across the country online in convenience stores, gas stations. And I mean, there are some states that have really stepped up and said, we don't want these products. We want to ban them. I mean, Texas, I was so impressed with them, California, but then they face legal action against them. And there's 21 AGs that came out and said, this is a public health crisis and we must address it. And this is, quite frankly, something that we could all help to make happen, because this is really harming kids. There was a survey that came out that over like 10% seniors were getting access. And this is in states that have said, we don't want legal THC marijuana sales. We don't want this. And so they are infiltrating. It's also kind of a race to the bottom. You have people that are in the THC dispensary business that are going into hemp because there are no rules. And these products are really, really dangerous.
And it's frequently the same stuff. It's just that now they label it as hemp derived, right?
It's very similar, and it's lab produced. It can be actually even more dangerous because they're putting all kinds of things in there. I mean, depending on, the actor, right? They're putting all kinds of chemicals. It's just a different form of THC. It's like synthetic THC and all kinds of different names. It's very confusing, but it's sold as hemp or CBD when it is not the non-psychoactive. And that is creating tremendous confusion, harming many kids and many people. I mean, it's a very serious problem.
Yeah. Well, what can parents and schools do to protect the kids? Is there anything, or are they helpless?
No, they are not helpless. Parents are not helpless. What we've learned is, you know what? Your schools, your family, your kids, elected officials, they need you. They need you to be informed on what's going on, what is being sold. We need to talk to our kids. And to your point, our kids are having to navigate so many things that we need to be talking to them. Whenever we speak, these kids come up to us and they're just like, oh my gosh, will you tell my parent? Will you tell my principal? Will you tell? It seems like nobody knows this is going on. They're watching it. They're watching their friends be harmed. They need our support. And there are very powerful interests in our state legislatures and on the Hill that are, pushing for these products to have no safeguards and to keep things as they are, quite frankly. And this is a multi-billion-dollar industry. It has grown rapidly in the last 3 years. It was basically bad actors exploiting a loophole. Like, we can address that. And we can say, like, look, we are looking out for our kids. And when it comes down to any policy making or decisions, between THC or psychoactive hemp profits versus, the health and well-being of our nation's youth and young people, we've got to come down on the side of the health and well-being for our children and young people.
That really is the key. We need to talk to our legislators, and we need to sit down with them and give them an understanding of how deleterious this is, what the impact is for the future of our country, because we're really talking about the people who will be running our country in the future. Do we want them to have effective mental status? Or do we want them to be, because some studies have shown that the kids who expose themselves to this early on are much more likely to fall victim to drug abuse later on in life. And, it's sort of like a gateway. We don't really want to open that if you really love your kids and you want them to succeed, and if you want our country to succeed.
Absolutely. I mean, they're now finding links early use to actually opiate use disorders. And here we are spending all this money trying to deal with, substance use disorders, opiate use disorders, and, to allow youth early marijuana use is what studies are finding a number one contributor to developing those problems later. And so, here we have a chance. Instead of always looking back after all the harms that have been caused, we have a chance to prevent some of these negative outcomes from happening.
And people don't talk about it, but there has been shown to be increased car accidents and things associated with people who are using these products as well.
Oh, absolutely. That's a huge, I'm sorry, I didn't say that earlier. That's a huge issue, including fatal deaths.
Yeah.
Huge and growing issue. And then once again, the perception of those using it, they think it doesn't impact their driving, a large percentage, which is once again a real education gap.
Remind us how people can see the work that you're doing and support it.
Oh yeah, we would love you to join us. You can go to our website at onechancetogrowup.org, and you can follow us on social media. You can sign up to receive our action alerts, because there are some very important decisions that could be taking place nationally. And in addition to, we also support folks in states that are trying to get these safeguards in place. We also have a lot of education. How do you talk to your kids about this? We have a whole website on the products, so you can safely go and you can look at what's being sold. It's called thcphotos.org. And so you can go and know the products that are out there. We've got it, broken out by states. And we always try to direct media to, when they're talking about marijuana, don't just show the plant. You got to show the actual products that are being sold. But I will say one thing. It is amazing what individuals can do. We formed this organization. We were just everyday parents. We were just worried about kids. We just showed up to make sure that, they would be looked at when they were figuring out the rules. And we just saw, wow, there wasn't anybody there. And that, this huge for-profit industry is really, leading the way on this. And we have to stand up and look out for our kids. We can get educated and informed. And also we bring you in, like if something's going on in your state, we can make you aware so that you can organize, and you can have a voice and you can work on these issues, where you live.
Well, what's the message that you want to leave with our listeners, particularly those who might not be aware of what's going on in their communities?
First of all, I really appreciate you having us on and talking about this issue. Not many people want to talk about this issue, and that goes for parents too. It's a hard issue. Most people are like, I don't want anything to do with marijuana. I never thought I would know so much about marijuana, but this is important. And your kids are facing this every day. And you really do need to be informed. And you need to talk to them, and they need to know you have their back. Research shows that 72% of kids are less likely to use if they think their parents or a trusted adult in their life disapproves of their use. I mean, that is profound.
That's big.
I mean, that's profound, right?
Yeah.
Right there. I mean, if we're informed and we're supporting them, and it also makes you informed of what's going on in your community. I mean, when I found out what was being sold within a mile of my house, I just could not believe it. And I was told by kids. I mean, the only reason I got involved in this were kids were telling me, it's like the adults have checked out. Where are they? We need their help. And that is what keeps us going every day, because we are just everyday parents that got involved in this just because we saw that kids weren't looking out.
If we can just transmit those messages, because I remember when I was a youngster, hearing all these things about dope, they call it back in those days,
Yeah.
and marijuana. And I had my guard up such that when I went to college and people were smoking marijuana, I would stuff towels around the openings of the door because I didn't want to smell the smoke.
No, oh my gosh. Well, I feel bad because the kids today, I have a son with a serious mental health issue, and his psychologist told him to go use marijuana. I
Oh,
went into a pharmacy and the pharmacist said, "Why are you getting that medication when you could go around the corner?" And thank heaven I knew what they were selling around the corner because
mm,
I asked her, "What are you talking about? Have you been in there? Do you know what they're selling?" And she didn't know. And so there's a lot of misperceptions, and our poor kids, I mean, this is being advertised on and marketed in kid friendly ways. Oh my goodness. There in many states, there's like billboards, there's, a doctor, saying, this helps with depression, anxiety, all kinds of
yeah,
challenges. I mean, these kids, it's really the adults, we haven't put these safeguards in place. It's very confusing for them. And quite frankly, they tell us there's so much pressure. It's so normalized that they don't even know what to say
yeah.
when they're offered it.
Well, if people go to your website, is there information about all the things that we've talked about?
Absolutely. We've got education information. We'd love you to sign up. I mean, together we could really close this hemp intoxicant loophole federally, which is what has to happen. I mean, the states are working away, but they need support because it's that was a loophole that was opened, unintended. I mean, no one meant to, but it's needs the definition of hemp needs to be clarified.
Absolutely.
One thing that I did want to let you know is that with the rise of these really dangerous hemp intoxicants, there are also all kinds of other dirty, contaminated, hallucinogenic products that are being sold in smoke shops, gas stations, convenience stores, and this can include kratom. This includes they have psilocybin. They have all kinds of things in it. We've actually tried to test some of these. I mean, it's really concerning, and some even include like nitrate oxide, which is laughing gas, that dentists use, and it's very confusing. So once again, these kids, they have easy access and they have no idea because they're presented like they aren't harmful. And once again, they come in these candy, kid friendly forms. They look benign and they think to themselves, well, how could they ever sell it, right? In a gas station if it's that dangerous, So that's just, it's very problematic. It's something we're keeping an eye on. We've had public health departments across the country call us about it and ask us like what they should do. I mean, this is a really serious problem that's spreading as well. But I think tackling the hemp intoxicant problem would send a message and could also, you know, get rid of those other products. I mean, part of this is there's just been so much, no one's done anything about this. And so everyone feels like they can just do whatever they want and put out whatever drugs they want and sell them, in that way, which is deeply concerning.
And tell us, what is that website again?
Yeah, it's onechanceToGrowUp.org.
And folks, if you know people, maybe you're not having teenagers or young people in your home, but you may know others, or you have relatives, nieces and nephews. Get the word out there, because it does make a difference for these young people if they know some of the consequences of using the stuff. Maybe they'll never start in the first place.
Right. And I will say something we worked really hard on, and this took literally, you would not believe it, a decade to get an education campaign out. It's called tonthc.org. That's another place where, it's from a school of public health based on the research. That can be a powerful resource as well. We've got links to that on our website, but we got to get more education throughout the country. And we've seen how hard it is to get the education out there because you've got really powerful special interests behind this.
Absolutely. Well, Diane Carlson, you're a patriot.
Oh,
And I want to thank you for taking an interest in your fellow Americans. Thank you for all you're doing.
thank you. Thank you for all you've done and do.
As we've heard today, the crisis of youth exposure to THC, it's not a hypothetical concern. It's a clear and present danger. And, from candy-colored edibles to unregulated, intoxicating hemp products, our children are being targeted by this industry that profits on their demise. And the costs are measured in emergency room visits, stunted development, and derailed lives. It's very costly for all of us. But we're not helpless. Parents, educators, faith leaders, policymakers can all play a role in pushing back. And whether it's demanding better labeling or supporting community education or simply starting conversations in your home, every step matters in the long run. And I want to thank Diane Carlson for shedding light on this very critical issue. And to our listeners, make sure you stay informed, stay engaged, and remember that protecting our children is not just a duty, it's a sacred trust. And that's it for this week. Remember, subscribe for free Apple Podcasts, Spotify, or wherever you get your podcasts. Rate us, review us, tell everybody about us, because we want common sense to be common once again. And remember the cornerstone principles: faith, liberty, community, and life. See you next week.